everybody, it's Gita from Doctors and Litigation with a reminder that civil litigation is a dispute resolution process. It was never set up to adjudicate your medical care. Stephen Cohen, colleague and friend, had a recent post, I'll try to link to it, about a case where a surgeon was on trial for medical malpractice and a radiologist who was not a defendant got up and said that he'd actually read the study wrong, and so the surgeon made his decisions based on that reading. And of course, it was totally reasonable that the surgeon did what they did, and then the jury came back and found the surgeon liable regardless. And there was a lot of commentary about how this seems patently unfair, and I felt it necessary to remind everybody that the most important takeaway is that civil litigation's actually not about your care altogether. This is sort of a group project with a lot of moving parts that everybody needs to understand. So until we actually have specialized courts or a parallel system of adjudication by experts, you cannot make any conclusions about the reasonableness of someone's care based on a legal outcome. Sure, there's a Venn diagram that overlaps sometimes, but sometimes it doesn't. And we all have to be aware of that. And we also have to be aware of how civil litigation actually works and what is important and how important it is for us to defend good care and show up as good witnesses, and how to work within this system to defend medicine, to defend good care. And if we don't understand that, we get very, very upset about gaps between our clinical reasoning and legal framing of arguments. And we want things to work a certain way. We feel like it should work a certain way when we actually just need to learn how it actually is. This is of paramount importance. It's a conversation that we have a lot on the podcast, and I feel like we should be having more and more.